When evaluating mobile health companies, we look at a lot of the same sort of aspects that we look at when we consider just a general investment.
There are always the normal things that you look at any investment, which is, is the market big? Are they going to be able to take a large percentage of that market? And do they have the potential, for example, to IPO? The other part of it is are they a prime candidate for an acquisition if they cannot become large enough for an IPO? Those are things that you would look for in any kind of investment. There are some special things in mobile health that one needs to worry about. A lot of the mobile health deals right now are lacking a way to make money. They're good ideas, but it's hard to follow the dollar, so to speak.
We look for areas of real differentiation, either through technology or business model, as a way of sort of setting yourself aside from the pack.
The other is finding a management team that's qualified, really, that knows things like reimbursement or insurance methodologies or government policy or the technology of smart sensors or what have you. And that's why we've seen, thankfully, a lot of incubators trying to generate that ecosystem that was lacking. But we look for management and investment to be able to drive this because a lot of it is a random walk, and we want them to kind of really drive through, find a solution as they try things and fail and iterate in the process.
We do put a lot of emphasis on the team. In mobile health in particular, I think there's a lot of challenges for these companies, and we've seen companies pivot and pivot again. And so what you do is you end up putting a lot more faith on the management team and the entrepreneur, assuming that they're going to run into roadblocks, as most companies do, most startups do. But I think it's fair to say that in mobile health, that's more likely to be an issue. And so what we aim for is for a management team that has ideally be proven in the past to be able to navigate some of the hurdles associated with running a startup.
I think between building the right team with the founding members of the company or seeing the right team in place already, I'd always prefer that the right team is in place already, because I think for a couple of reasons. One, that's no easy task, and it takes a lot of time and energy to craft that team and recruit top members. But I think also it's sort of a signal that the founder can sell the story to credible CEOs, to credible executives, to credible engineers that they need to develop the product. And I think that is a signal that they've also done their homework on the business model, on the customer needs, and on the feasibility of a technical solution. So, for a couple of reasons, I'd rather the team already be there. That said, it's always nice to be able to bring people that you know and trust and have a long-standing relationship with, that you think could add huge value to an organization early enough so that they can have an impact, as opposed to trying to displace existing members of the team.
Sometimes we look at IP, it's not really as, it's important, but it's not essential in this field. What we think about more is, can they scale? Because the risk is a little bit lopsided. The risk is not immediately whether technology works, but whether the business will scale beyond the initial adopters.
I really like therapeutic digital health products and services, so things that can be measured clinically in terms of their outcomes and the benefit to the system or cost reduction. I think I'm less bullish personally on a lot of the consumer-directed mobile health opportunities that require convincing a lot of patients to pay out of pocket for things, unless, of course, they've historically paid out of pocket for those same services. So fertility, ophthalmology, aesthetics, et cetera. I think there it's easy for patients to pay. But I think the themes that I tend to like are companies that understand the healthcare system and who the stakeholders are and how you resolve their needs and their economic considerations. So fundamentally, alignment with payers and alignment with the existing healthcare system are themes that I think will translate into returns for mobile health investors.